My name is Hayley McDougall. I'm just going to tell a story. Do you want to sit and listen? In 2002, I woke up in the middle of the night with piercing daggers through my temples. And from there, life sort of sent into a spiral of tests and treatments and trials to try and figure out where this pain was coming from. I finally ended up at the Mayo Hospital in Arizona, where they diagnosed the pain as new daily head pain, which essentially means that it never goes away. So unlike most migraines that come and go and have triggers, my pain is constant and it will fluctuate from 10 out of 10 in the worst, most incapacitating days. Right now my best days are about 8 out of 10, which over the past 12 years I've just learned how to function with.
Hayley's had everything from craniosacral therapy to swallowing the tincture of bull's blood to every kind of manipulative treatment that somebody could come up with.
After the pain started, I went through all kinds of Western medicine trials and treatments and a lot of holistic remedies as well, and nothing was working, and I ended up at a hormone specialist who put together the correlation that when pain started, my menstrual cycle completely stopped. So I went to endocrinologist and gynecologist, and they all said, no menstrual cycle, you're not ovulating, no kids. Now we have 2 beautiful, healthy little girls, call them the joy makers.
There's that old saying that it takes a village to raise a family, and you know, I don't think it's ever been more true than in our case.
The Mayo Clinic is incredible. Dr. Dodick graciously agreed to meet Hayley. Our next step was to try and convince our medical plan to pay for that event, and eventually, after some pretty serious recommendations from Dr. Robinson about the fact that he had exhausted all possibilities to treat Hayley in Canada, the medical plan did agree for Hayley to be seen by Dr. Dodick. Off we went, and Dr. Dodick was willing to try a few of his treatment therapies that he had done on other patients. And when these also failed, he agreed to enroll Hayley in a nerve stimulation study.
There's been 6 surgeries now that have gotten me to this final point where I have 16 points of stimulation. I have 2 occipital leads and 2 temporal leads, and each of them have 4 points of stimulation along them, so that's 16. The wires start here, here, and in the back here and here, and they run down my head, down my body, under the breast tissue here, and into the battery here. And what the stimulator is designed to do is interrupt the message of pain traveling along my nervous system. So new daily head pain is a combination of migraine issues and nervous system problem, where the only way to stop the message of pain is to interrupt the nerves from delivering it. I have a remote, so I turn it on and I can adjust the programs. The way that it works is the longer it's turned on and the higher it is, the more it will interrupt the nervous system. So the occipital ones I've now had in for 7 years, and the temporal ones, they've been in for 7 months now due to some of the infection complications. They had to come out and go back in. So now it's a matter of just waiting, leaving it on, letting it work, and seeing at what point it will reduce the level of pain to a level where I can function a little bit more.
I'm not done yet. I'm not done. I'm gonna keep fighting. Too many things to look forward to.